All right, today, testosterone specifically for men is what we're going to be talking about. Our most popular testosterone at Moses Lake Professional Pharmacy is in a toppy pump. The most popular dose is 200 milligrams per pump. We actually calibrate the pump to make sure that each pump delivers 200 milligrams. We are the only pharmacy that I know of that actually does that. We've calculated to make sure that one pump delivers 200 milligrams, whereas most pharmacies, they make it up per weight, like per gram, but it dispenses 1 mil. So they don't get an accurate dosing of testosterone. It can be off by up to 25%. So we do know that our pumps deliver the labeled amount that we say it's going to deliver. So why would a man need testosterone? Typically, as we age, our hormone levels decline, okay? And that usually starts when we're about in our mid-30s. Some men might need testosterone earlier than that, but most men start declining in their mid-30s, and usually they don't see symptoms until their mid to late 40s. What kind of symptoms are they? High cholesterol. Your cholesterol's been fine for the first 45 years of your life. Now all of a sudden you have high cholesterol. So what do? We give somebody high cholesterol medication, when in reality it could be that their testosterone is not optimal, because testosterone helps to lower cholesterol. What are some other symptoms? Depression. What do we give a man? We give them a medication, an antidepressant, when in reality we could just give them testosterone possibly if their testosterone is not optimal. What else? Erectile dysfunction. So what do we give them? We give them something to help their erections, when in reality we could give them testosterone and that could help their erections. Decreased libido. So erectile dysfunction, decreased libido, decreased energy, weight gain, especially around the middle. Testosterone helps us to maintain lean body mass. All those are symptoms of low testosterone. You don't necessarily need a medication like a drug, an actual drug for that. You might just need your testosterone balanced. Our testosterone at Moses Lake Professional Pharmacy for men normally comes in a pump. Each pump delivers anywhere from 50 to 200 milligrams, and of course we can compound any dose needed. We don't usually put anything more than 200 milligrams per pump. It would be too thick and it would not dispense in the pump. We are the only pharmacy that I know of that has done a study, a case study, to show that our testosterone is absorbed over time. So we did a study of absorption at time 0, right before the testosterone was absorbed or applied. We did time 1 hour after it was applied, 2 hours after it was applied, 6 hours, 12, and 24. We only published on the 0 to 6 hours, and what it showed with the testosterone that we compound up is that it is absorbed very well at a consistent level. You don't get high peaks like you do with injections. What are the high peaks going to cause? The high peaks are going to cause side effects, possibly because testosterone converts to estrogen, to estradiol, and that's when you'll get those high peaks. Our testosterone study showed that it was absorbed consistently over time without the high peaks. Why? Because our skin is a great mechanism to prevent poisons from being absorbed too fast. Our skin doesn't know the difference between testosterone or any foreign substance for that matter. It just protects us from foreign substances from being absorbed too fast. So actually what that does is it makes a great delivery device to deliver a topical hormone like testosterone over time without causing high peaks, because it'll slowly release over time, and that's what our study shows. That's why I normally recommend testosterone delivered in a topical pump instead of injections, instead of pellet therapy. It is definitely absorbed. We know that because we have shown that in a study. Okay, so how to use the toppy pump. You've been prescribed testosterone, and normally the dose is 1 pump every morning. Like our study, we normally recommend applying it underneath the scrotal area, so in the perineum. Why? Thin skin, so you get good absorption. It's got good blood flow, so you get good absorption. And then you have less risk of transferring it to somebody else than if you had it on your upper arm and chest area. So it's pretty simple after that. Take the lid off, take the little cap off, and you apply 1 pump, just like that. It's about a pea-size amount, and you apply it underneath the scrotal area every morning, and then you'll get a good dose of testosterone all day long. And you want to make sure and wash your hands with soap and water after you apply it and rub it in well. So if you have any questions, you can always get a hold of us, www.mlrx.com, Moses Lake Professional Pharmacy Facebook page. Thank you for listening today.